Hi everyone, welcome to ETC Thursdays because every try counts towards quitting tobacco. Today we're trying out a new format here on stereo. Let us know in the comments how you feel about this. I hope our audio is coming in clear. We also have a guest with us. We have a new team member on our staff. That'll be Ashton. You'll be hearing from her shortly. Again, this is just Caleb.
And hey everyone, I'm Fatima, and we are certified tobacco cessation specialists with Corktown Health Center. On today's segment, we'll be discussing some common myths and misperceptions about quitting with nicotine replacement therapy, and we'll also offer some helpful tips to help you keep on the right track towards quitting.
Thank you. I believe we actually have Ashton sending the first question in right now. Let's see what that is.
What is nicotine replacement therapy?
I'll go ahead and take this one. Nicotine replacement, or today we'll actually be calling it NRT, is actually the use of a prescribed or over-the-counter medication that helps you either stop smoking, vaping, or chewing tobacco. According to the FDA, there are 5 recognized forms of NRT. Some of you may already know these as patches, gums, lozenges, nasal sprays, and an oral inhaler. These all work by delivering nicotine into your body via different methods to help curb your cravings or withdrawal symptoms. There are other types of medications available as well, but we'll discuss those on another day.
Can I use more than one NRT at a time?
Yes, you can use more than one NRT product at a time, or at the same time as smoking cigarettes or e-cigarettes. Combination therapy generally provides better results than just using one form of NRT. Some smokers find that they have more success by starting with combination therapy, for example, using both patches and the gum at the same time, rather than waiting to see if one product is enough on its own. This may be particularly useful for heavy smokers with higher nicotine dependency.
And this is also partly because they act in different ways in terms of delivering nicotine and how quickly they treat your symptoms. So for example, the gum you could take to treat your craving in the moment, whereas a patch is an all-day kind of thing. Let's see what else we got here.
Can people with heart disease use nicotine?
Okay, I've heard this one before actually. It is more dangerous, just let me say, it is more dangerous for clients with heart disease to continue smoking than to use the patch or gum. NRT products have been shown to be safe in most people with heart disease. However, because nicotine can increase your heart rate and blood pressure, it's a good idea to talk to your doctor before using NRT products. If you've had a heart attack or if you've had serious heart problems such as an irregular or rapid heartbeat or chest pain too.
What about other medications like Chantix and Zyban?
So each of these other medications have certain things that need to be considered and discussed with a medical provider because some of the interactions that they may have with other drugs, which may not make them appropriate for everyone to try. So if someone, for example, is on additional medications, they may need to adjust the dosage of those medications to be able to continue using Chantix or Zyban. We'd actually like to have another conversation about those and another day because we will be able to kind of go into a little bit more detail about what the medications are and, what side effects you may have or experience and what conversations you need to have with your doctor to be able to kind of have, get those prescribed.
Good question, though.
Okay, we have another question.
Do you provide NRT products?
So our program does not provide NRT products, but we can give you a referral to a medical provider for over-the-counter or prescription nicotine replacement products. Also, people who are eligible for Medicare or Medicaid may also be eligible for free NRT products. Recently, insurance coverage for NRT has actually expanded under many private insurance plans as well. Many plans will cover NRT products without copays. Just check with your insurance plan to learn if you're eligible for coverage. There are also state programs you may be available for to get additional assistance paying for those products. For example, we actually have the Michigan Tobacco Quit Line. If you want to give that one a call, that's 1-800-784-8669. Again, 1-800-784-8669. Even if nicotine replacement therapy is not covered through your insurance or a local quit line, wherever you happen to be, over time, the cost of nicotine replacement therapy is less expensive than the cost of cigarettes. You can save up to nearly $2,500 per year by quitting smoking or reducing smoking by 1 pack a day.
What about over-the-counter products?
So gum, lozenges, and patches are available over the counter. Gum and lozenges can be used to curb cravings in the moment, so you can use them almost as frequently as you smoke or vape. Patches are used all day and release nicotine over the entire day before they're removed. And there are different strengths based on how often you smoke and or how soon after waking up you smoke, or how much you smoke, how many you smoke per day.
What is the best way to use the lozenge or gum?
So the nicotine gum actually comes in several different flavors and in 2 strengths. That's going to be 2 milligram and 4 milligram. Start with the 4 milligram gum if you smoke more than 20 cigarettes a day, if you're smoking your first cigarette of the day within 30 minutes after you wake up, or if your doctor does recommend that. Don't chew this gum like you would with regular gum. Instead, you're going to use what we usually call the chew and park method. So with this, you're only going to chew 1 piece of gum at a time. You're going to chew it slowly a few times until you can taste the nicotine. So how do you know when that is? If you get a peppery taste or a slight tingling in your mouth, that's when the nicotine is actually being released from it. So you're going to chew on that for roughly 30 seconds. If you have any trouble remembering how long is 30 seconds, you can just, sing the happy birthday song 3 times. Then you're going to park that piece of gum between your gums and your cheek, and you're going to leave it there. When the tingling is almost gone, you're going to start chewing that piece again. Just repeat that process for about 30 minutes or until the tingling and the taste is no longer there. You're also going to want to make sure that you rotate that piece of gum to different places in your mouth. Fatima, is there anything you want to add?
Yes, so chewing the gum without parking it can often cause stomach ache, hiccups, heartburn, and will take longer for the nicotine to absorb into your bloodstream. So try to keep it parked as much as possible, and also try to avoid eating or drinking especially acidic drinks like coffee, juice, or soft drinks for at least 15 minutes before or while chewing the gum. And so that can help it absorb into your bloodstream longer, and you won't have the other issues.
Can cutting the patches in half help it last longer?
So I've heard this one. Some people think that they can cut patches in half to get a smaller dose or save money. If you cut a patch, the dosage rate is going to be uneven, so that nicotine release is no longer going to be steadily released. Patches are also another thing that come in different strengths. That's going to be 17 and 21. A higher dose of nicotine will be delivered early if you do cut parts of that patch. You could potentially overdose on nicotine using a cut patch. Cutting a patch will also expose the layer containing the nicotine, allowing it to leak through the cut edge or to be just lost. However, if you do decide to go ahead and cut a high-dose patch to save money, be sure to talk to your pharmacist or doctor before experimenting on your own.
Why is the patch not sticking to my skin?
So if you're having trouble getting the patch to stick to your skin, there are some helpful tips that can help you make sure that it stays on. So first, you want to apply the patch to a non-hairy, non-irritated area of the skin so that it incurs minimal perspiration throughout the day. Also, you want to make sure to not apply any creams or lotions on your skin where you're putting the patch. If your skin is oily, try to clean your skin with rubbing alcohol first to kind of get that place a little bit drier to help with the patch sticking. And if you followed all these directions and the patch still doesn't stick for you, you can also try using a Band-Aid or medical adhesive tape or any other kind of wrap to kind of help the patch stay on.
All right, well, thanks for tuning in. Let us know if you liked this format in the comments. We're open to trying it again. If you want to hear another topic, also let us know. Just remember that I know we were talking about nicotine replacement therapy. This was just a basic introduction to that. We do want to revisit this in the future. And remember that nicotine replacement therapy is one good tool to help you quit smoking, vaping, or chewing, but it can't do all the work for you. You have to help. It's not the only tool that can help you stop these things. Ask a doctor about other smoking cessation medications or counseling resources that can help you give up tobacco for good.
For more information or to receive one-on-one support from a tobacco treatment specialist, you can contact us at 313-832-3300, extension 108. That's it for today's segment. Tune in every fourth Thursday of the month
for new episodes or catch up on old episodes on our